my guest, Adam Russo, the Chairman and CEO of Edgewood Clinical Services. Welcome, Adam.
Hi.
Thanks so much for being here today.
Thanks for having me.
I guess the first thing that I'd want to ask you about is about your counseling services. Can you tell me a little bit about that?
Sure. We're a full-service mental health agency, so the prominent thing that we do is counseling, and so we have just under 30 clinicians on staff, licensed social workers, counselors, psychologists, varying backgrounds. So people who have experience working with anything from families going through divorce, anxiety, depression, developmental disorders in kids like autism and Asperger's, trauma or abuse in the home, range of things, and their abilities to form, whether it's behavioral plans for kids, whether it's working through kind of the emotional issues for adults, and then, but most importantly, putting together practical plans to try to help people kind of get to their identified goals.
Yeah. Have you noticed an uptick, like with the long winter? I bet that's been so tough on people.
And in general, the winter has been tough, but in general, it's been year-round, and it's been a lot of a range of different things, and the focus on school performance, a concern with school performance with kids, bullying, relationships, that even kids as young as preschool age, what are the types of relationships that they're getting into, social skill concerns, anger management issues. Parents are really trying to get ahead of potential problems down the road, and so they're bringing kids in a little earlier. So we've been seeing consistent calls throughout the year.
Wow. Well, tell me a little bit then about the psychological testing.
And which falls kind of along with the counseling. So when we see young kids, and a lot of the concerns that we get from kids is from learning performance or things like, does my child have ADD, things like that. We use the diagnostic assessments and testing quite a bit, again, for those examples, but also for diagnosing pervasive developmental disorders such as autism and Asperger's, as well as anxiety, depression, distinguishing between the two in order to know how to best treat, whether it's through counseling or medication going forward. Because, for example, with ADD, just because a child has a loss of focus doesn't mean that that's the diagnosis. A lot of times the behaviors can be just from a nonverbal learning disorder. Their processing speeds cognitively, they just can't keep up sometimes. Other times, it's just a learning disorder. So if they're struggling with if their behaviors are acting out in like a math part of the class, let's say, maybe they have a math disorder or dyslexia, and so the learning issues are creating behaviors that look like attention deficit, but it's from a different root. So and that helps with treatment planning. Interesting.
I know you brought a new MD on staff, so tell me a little bit about that.
We're really excited. His name's Dr. Chris Sinnepen. He's worked at Linden Oaks for historically in the past. Now he's currently up at Streamwood Behavioral Health. He's running a program there, but he's with us 1 day a week right now. He's going to be up to 3 days a week come October. He's a board certified child, adult, and general psychiatrist. So he'll see kids as young as 5 years old. But he's also very cautious with medications, whether it's with kids or adults. He looks for lots of different alternative interventions. Really believes in counseling and diagnostic assessments. Really fits our culture and system.
Wonderful.
And so we're really excited to have him. He's been a really good addition.
That's wonderful. Tell me about your groups.
Our groups, it's a program that we've started, probably 5 or 6 years ago, and they just keep expanding. We do a lot with young kids, with social skills and anger management skills. So we have groups for as young as preschool age, and then we stagger them in ages going up. So our social skills groups just could be for preschool. Then we have a group for kindergarten and first grade, and then for second and third grade. Some are co-ed, some aren't, but they're play-based groups. For the young kids, it's play-based with the goal of developing social skills. With the older groups, they get more curriculum-based when it comes to anger management skills, and a little bit more organized for the junior high and high school age.
Sure, that makes sense. So tell me about your workshop for parents.
Yeah, we've periodically been doing workshops for families. We see a lot of families that come in. Parents have lots of questions about just how do we manage certain things with our kids. And so one of the things that we do is put on workshops based upon what we hear from families and for the community, and have try to offer some education around some topics, because a lot of times families don't necessarily need counseling per se, but they do need just some education on just and ideas and how to manage things. And so we do those topics periodically.
That's a wonderful service, especially with everything that's going on. You mentioned the bullying earlier, and social media and all of that.
Sure.
Tell me about your continuing education for professionals.
Yeah, this is what we're really excited about. We received our continuing education license last year, and so it's for any social workers or counselors who we all need continuing education to maintain licensure, and it's something that we do in-house that our clinicians do in their areas of expertise. So we put on 3-hour trainings that's open to professionals in the community. Because we work so closely with the school districts, we offer those at no charge to district social workers because they need their licenses too.
Absolutely,
And so it's our way of giving back to them and just as another alternative to do that. But this summer we have one planned every month from May through September currently on a variety of topics that are 3-hour trainings to hopefully improve clinical practice.
And do they come to Edgewood?
Yes, it's at our Naperville office.
Okay,
yeah.
Wonderful. I know you're very involved in the chamber, but tell me about your community involvement.
Yeah, one of the things, we're trying to do a lot of different things. What we try to do, one of the things, our biggest thing that we do is with District 203. We do have a formal business partnership with them, but what we do in our separate contracts, but we also work a lot with the Naperville Education Foundation, and what we do there is the Naperville Education Foundation has a booster grant program. And these are for kids and families who really can't afford many things. Sometimes it's clothes, sometimes it's medical, and kind of everything in between. So we work with that booster grant program for kids who really do need some help in counseling or testing or whatever the case is. And we're able to stretch the dollars that Naperville Education provides. So if they provide a fixed amount of dollars to us to provide counseling services, we stretch those dollars out so that it doesn't just cover a couple of sessions for a child or family, but it can cover multiple sessions so that the kids and families can really get on a good path going forward, and those things are maximized. And we're doing a lot. We've done quite a bit this year with the Valley View School District down in Bolingbrook, assisting them with some of their difficulties that have happened at some of their schools, and volunteered a lot of time with crisis intervention services, and currently also working with Indian Prairie District 204 on some different endeavors too.
Great, that's wonderful. Yep. Getting involved with the education system is fabulous. Can you tell me what might separate Edgewood from some of the other area services around?
There's, at this point, there's a few things. One is that we are a full-range mental health facility at this point. We have all the disciplines on staff, whether it's counseling, psychiatry for medications, and psychologists for testing.
Yeah.
And we also provide groups and our general workshops for kids and parents. So we provide a full range of services. We have a multiple number of clinicians that can handle many different issues that people call in with. So we feel very confident in being able to manage these things effectively. We're in network with virtually every insurance program. So any policy will typically be in network with, as well as employee assistance programs that are a benefit to people through their place of employment. And then because now with health reform, many people's deductibles have gone up. Even though people have insurance, finances are still an issue. We are able to work out flexible payment arrangements and really work with families in order for them to ensure that they're getting the help that they need, but also that it's financially manageable.
Fantastic. Well, Edgewood is a wonderful asset to Naperville. So thank you so much for joining me, Adam, and we will be right back.